First, let me begin by thanking everyone for coming today. I want to take a minute and just say that I've called Gaston County home my entire life. I was born here, raised here, own a small business here, and my family still resides here by choice. When it comes to family and people throughout the county, I do not take anything lightly. And when it comes to our health and our safety as a community, that is utmost importance. I also do not take lightly our ability to provide for ourselves and our families. So as I've continued to go straight to the source to get the facts on what's going on with COVID-19 from our hospital leadership, in-house doctors, our county leadership, and health department clinics, I decided, and our team decided, that the people deserve to know what we know. They deserve to have a county government that does its job. What I've learned from clinical leadership and personnel in our community is that we have experienced signs of community spread. It is clear to me that we have to be swift and act as local government to do what we can do to make sure that this virus does not spread beyond what is imaginable. Fortunately, we are acting earlier as opposed to later, in announcing that today a stay-at-home order will go in effect for Gaston County citizens as of 5 p.m. tomorrow. This stay-at-home order will extend until April the 16th. Our gatherings will be moved from a maximum of 50 people to no more than 10. Yesterday, I was on a town hall and I discussed why Gaston County at that time had not taken the step of doing a stay-at-home order. In that town hall, I made it very clear that as the facts change, as the information changes, and depending on what the experts tell us, we would need to change with that. Effective this morning, that has happened. We are going to be less restrictive on manufacturing than similar orders that are in Mecklenburg and Cabarrus counties. We are not going to require you to have a letter or permit to say that you're essential business. If you work for an essential business, just go to work. The message is simple. If you don't need to be out in public, don't. Go to your grocery store, pharmacy, carry-out restaurant. Those are everyday needs. But other than that, stay home. Also, there is no need to hoard. We are seeing a lot of that at our grocery stores. There's a lot of folks that are not getting some of the supplies that they need. I think this is an opportunity again to love our neighbor as we love ourselves and prefer those in our community. There are still too many people or groups gathering for social purposes. And as frank as I can be, if we as a community do not heed these orders, we can only go so far. So after this, we would basically have to lock everything down. We don't have to do that if we will listen to these orders, abide by these orders. We can, I believe, prevent that. I just want to say this. I have struggled deeply with this decision. It is one that even last night as I was getting information, I began to pray about it. I called my pastor. We prayed about it. It's not an easy decision, and it will affect every area of this community. I know that. I know that as a father that has 2 children. I know that as a small business owner that is already losing money. I know that as a government official, knowing what I'm hearing from our hospital. But if we work together, do the right things, lead, make the right decisions, we can make a difference in our community. I'm not panicked. I don't think there's a reason to be panicked, but I do think we should be informative, we should be calm, we should be smart, and we should consider others at this time. Thank you.
My name is Dr. Todd Davis. I'm the Chief Medical Officer at Caramount Health. Caramount's mission is to provide compassionate, exceptional, and highly reliable care. And every member of our staff, medical staff, leadership team, and our board take this extraordinarily seriously. We are focused on protecting our patients, their families, our staff, and our providers. Part of the protection includes proactive planning and preparedness for potential disasters. Our planning and preparedness for COVID-19 potentially impacting our community began in middle January at the request of my CEO, Chris Peak. Since then, we have been engaging actively with our local government, Gaston County Department of Health and Human Services, Gaston Emergency Medical Services, Gaston Family Health Services, and multiple independent providers in our community. The events related to SARS-CoV-2, the name of the virus that causes COVID-19, are rapidly changing and unprecedented in our lifetime. We have watched the virus spread from China to other countries, to Washington State, to New York, then to our neighbors in Mecklenburg County, and now it has infected members of our community in Gaston County. 2 weeks ago, North Carolina Department of Health and Human Services informed all providers that at that time, people testing positive and having COVID-19 had all in our state been related to travel. So they had contracted the disease as a result of travel. Last Monday night, a week and a half ago, Monday night, March 16th, we were informed by North Carolina Department of Health and Human Services there was community spread in North Carolina, which means the virus is now spreading between community members, not directly related to travel. Currently, Mecklenburg County has over 181 patients who have been diagnosed with COVID-19, many through community spread. Today, we learned that Gaston County residents had tested positive, not as a result of travel, but through community spread. For this reason, I and Mr. Peak and our leadership team completely support the extremely difficult decision made by Chairman Tracy Philbeck and our county commissioners to ask our community to stay at home. This decision is based upon recommendations from the Centers of Disease Control on how to reduce spread during a pandemic. I would appeal to all the citizens of Gaston County to take this seriously and follow the orders our local government has given to reduce the likelihood that you and your loved ones and your neighbors would become infected. Thank you.
Thank you, Dr. Davis. My name is Chris Dobbins. I'm the Director for the Department of Health and Human Services. And as was mentioned by Commissioner Philbeck and by Dr. Davis, we've been monitoring the COVID-19 virus and its response for several weeks now. And the reason that we have not made decisions and the reason that we have made decisions has been based on evidence, based on facts, based on numbers. Yesterday, Gaston County sat at 5 positive cases, tested positive cases in our community. Today, that number has risen to 11. So with the consultation of our medical community, Dr. Davis, the support of their CEO, Chris Peak, the discussions with our leadership, our county manager, Dr. Eagle, our commissioner chairman, Chairman Philbeck, and the other professionals that provide data, examples, and best evidence, we've reached the decision that Commissioner Philbeck shared with you. Gaston County is in a unique position in that we are able to learn from the events that have happened in China, the events that have happened in Italy, the events that are currently taking place in New York and Louisiana. And we've been monitoring that information and their response, which has led us to believe that the more that we can do to separate our citizens, increase social distancing, the better our response and the impact on our community will be. During a pandemic, you're fighting a war against a disease. In this type of war, our bases are our hospitals. Our soldiers are our healthcare workers. This order is to support their efforts, and our ask of the community is to rally around their call to action. Thank you.
Thank you, Director. I want to speak briefly to what Gaston County government is going to be doing in the days ahead and what we have been doing. We are moving, as of Monday morning, to key personnel only. What that means is that those that have been identified as department directors as not being part of key personnel will be placed on administrative leave. We're offering that administrative leave that is not sick leave, that is not vacation time, but we are offering that for up to 7 weeks for those employees. Those that are key personnel will be working from home. That does not mean that Gaston County government is closed. Let me be clear about that. We are altering the way that we conduct services to keep our staff and our citizens safe. But I want to be as clear as I can be. We are open for business. We will continue to serve the needs of the business community and our residents, but we will do so in a safe and sensible way. We believe that we're leading by example with these measures. This is a necessary step, and we would encourage other businesses and government entities in Gaston County that if you have not taken such steps, that you strongly consider them. We know that there's going to be a lot of questions about this order, and one of the ways that we're going to help answer the questions on the part of the business community and residents at large is to create a hotline. We're calling it our Stay-at-Home Community Hotline. For those of you that are watching on our cable access channel, that number is now on your screens, but let me say it for the folks that are watching with our friends here in the media. That's 704-866-3170, 704-866-3170. We're going to begin staffing that as of tomorrow morning at 8 a.m. When you call into that, you're going to get somebody here at Gaston County that can answer your question regarding the stay-at-home order. We want to make that resource available to our residents. It's going to be available 8 to 5, Monday through Friday, for as long as we need to keep that up. With that, I'll open it up to questions from the press. We also, and before I open that up, I do want to mention that we have our county manager, Dr. Kim Eagle, here, as well as the Caramont CEO, Chris Peak, also available to answer any of your questions.
Just for county purposes, your name and spelling.
Sure. Adam Gaub, it's G-A-U-B, Public Information Officer here at Gaston County.
I guess this will be for Commissioner Philbeck. How exactly, in terms of enforcement, will we be seeing police officers writing citations or misdemeanors for anyone who doesn't follow the order?
Our goal from the beginning has been self-policing, asking our community to do these things themselves. Our police have a lot of other duties that they need to be doing. So our hope is that our community, and what I believe about Gaston County, is that we will do the right things that we need to do to protect our community.
Does that mean it's voluntary then, or are we talking about actual citations? How would this work?
Within the order, there is an enforcement statute that can be enforced, but again, it is our hope that our citizens will self-police and do those things voluntarily.
Tracy, while you're there have been some questions about that April 16th date, and whether that is going to be adequate. Is that a hard date? Is that something that we're going to examine and possibly will extend? What about that date?
Well, yesterday we didn't have a stay-at-home order, and today we do. So I think that speaks of the ever-changing dynamics of the situation. It is our hope that that's a good number, but we have to be realistic and look at the numbers and the data and the modeling as it comes in. That could go longer.
At one point you were doing what I believe is some consequencing and explaining that if these measures aren't followed, then things can be more strict. Have we examined what that looks like, what a second phase might look like if these measures don't work?
Our goal here in Gaston County is this: we want to be open for business. People have to be able to go to work, provide for their families. I live here. I know people here better than anybody. We're a proud people. We work hard. We want to live. So I think with these orders of staying at home, doing the social distancing, hopefully our citizens will grasp the real importance of that. With that said, if we continue to see numbers spike and people don't heed the experts, we'll have no choice but to lock it down. And that's...
What would lock it down look like?
Those scenarios, we go through a lot. That could be where a hospital just cannot maintain capacity. It could be a huge spike in numbers. It can mean a lot of different things. I don't think we're there. I think we're a long way from there. I want to make that very clear. But people have to take this serious. This is not the flu. I have a friend in Caramont right now who probably won't be here much longer because of this disease. That's hitting pretty home. This could be your mother, it could be your father, it could be your neighbor, it could be someone you go to church with, a co-worker. We owe it to our citizens to do that. And I know there's a lot of people out here that all the conspiracies and the hoax and all of that, whether you believe that or not, here's the reality. We're reaching capacity. People are getting this. And it's not just older people. It's really affecting people's lives. So unless we take that serious enough, there's going to be consequences to that. And as chairman of the Gaston County Commission, that's my number one job: the health, safety, and liberty of our citizens. So it's not an easy decision. I'll be frank. I've had people say, well, won't you wait? Let the governor do it. Let him take the flag. Or won't you pass it off to someone else? But that's not leadership, and that's not caring for your community. It's not an easy decision. There's going to be hundreds of people that say, well, this is what I would do. But when you listen to the experts, you look at the modeling, you look at the data. From yesterday, we've doubled our count from 5 to 11. We have confirmed community spread. We have folks in the hospital in very bad condition from it. We have to make a decision. And that's why we're doing the things we're doing. But it's that important. I cannot say that enough.
I want you to speak from a personal point of view, and I know you don't want to get too deep into it, but what is it like going to the hospital and visiting somebody who's suffering from something?
Well, I'll tell you what it's like. You can't go. Because of this, you can't even go in the hospital and visit unless they're getting ready to die.
From that perspective, then it's just waiting. Because I think a lot of people don't view it through the lens that you're viewing it now.
I think a lot of people need to stop being selfish and think about other people. And now is the time to do that. I mean, we're Americans. We're good people. We're a good faith community. And now's the time to do that. That's what we're asking. No one wants to police anybody. Of all people, I have no desire or joy telling people to stay at home. But it is our hope, and I say that prayerfully, that our community will step up and do this for the sake of others.
Actually, I have a question for Dr. Davis, if you don't mind. Just wanted to ask about the status of COVID-19 tests, if you all have been giving enough tests, and how operations are looking at the hospital right now.
So Caramon is actively testing. There has been, I'm sure, as you've read in the press, a national, a state, and regional challenges with testing. We are actively testing. We have started pursuing, weeks ago, multiple options, and we are continuing to be able to test more people as directed by the North Carolina Department of Health and Human Services and FEMA. And we are using their guidelines on who to test, and those were just revised 2 days ago.
Have you all had any issues with getting personal protective equipment, or I know there's been talks of other hospitals having issues with supplies of that?
So every hospital, every clinic throughout the state and the country have issues getting personal protective equipment.
What's the need now at Caramount for you? Is there something in particular that's in greater need of ventilators? Is it masks? Is it clothing? What is it?
I think the most important thing that we could do to slow down the spread of this disease is comply with Chairman Tracy Philback's and the County Commissioner's ordinance to stay at home. That is really the most effective way to slow the progression of this virus. We are working with our county and our state partners to manage any of the shortages that we experience, and there are pathways and processes for us to do with that.
How has that worked, those pathways and processes?
We've been able to get some replenishment of personal protective equipment from the state, and I'm sure they will be there for us if we have any further issues.
So you're in good shape now?
We have adequate supplies for the protection of our staff currently.
And how about the patient care? Is it adequate?
Yes, we're very fortunate. We have an extraordinarily professional group of clinicians and providers. We have experienced a significant drop in volume, which would be expected, and that's typical, and we're hearing the same from every other organization in the state. But the acuity of patients is going up as a result of this, and so that puts pressure on our critical care services. But we are able to adequately provide the services the community needs.
If I could, I'm going to jump in here. Thank you, Dr. Riggs. The chairman had asked me to have Chris Peak, who's the CEO, come up and talk a little bit about one of the things that will be accompanying this order, and that is a letter that's coming from Caramount and some of the other health systems, and just talk a little bit about why they drafted that letter and what the needs are. Mr. Peak.
Again, I'm Chris Peak, the President and CEO of Caramount Health. A couple of days ago, I reached out to my counterparts at Atrium and Avant Health, Mr. Gene Woods and Mr. Carl Armato, both sharing the same concerns about community spread, and both of those gentlemen were in complete agreement with writing a joint letter to the Gaston County Commission supporting a stay-at-home order. And so we delivered that to the commission this morning, and we applaud them for taking such quick action on that recommendation from the 3 hospital systems that serve this region.
Any other questions at this time?
Question for Chris Dobbins. How many people have been tested in Gaston County? We have 11 positive cases, but how many people have been tested?
Last count was over 400. That count is not accurate today because I have not gotten an update today. What I can tell you is we continue to get more test kits in, and we have the ability to test more individuals. But that is also a changing process where we follow guidance from the state and the Department of Health and Human Services.
How come, are you going to be more forthcoming, not that you have not been forthcoming, but are you going to give more details about where these folks live, what part of the counties, how they have, but other people are, you know, just gender and ages.
So
been helpful.
It's a great question, and we certainly understand the community's desire for more information. In early numbers, in very small numbers, when you share that information, it's not very difficult to place individuals, i.e. 1 or 2. Even with categories, it's not difficult to place individuals. So once we reach a threshold by where we can categorize and show those demographics and show those locations so as not to violate patient privacy, we will do that. And I assume as those numbers climb, that will probably be in the not too distant future. But I'm sure you understand the importance of protecting patient privacy.
Where do you see these numbers in a week, 2 weeks? Where do you see these numbers?
So you've heard the term modeling. You've heard the term evidence. What we're seeing is a very consistent rise in those percentages. Our latest model projects our peak would be at the potential beginning to middle of May, possibly as late May. So what we're trying to do now with these measures, social distancing, stay at home, is to basically flatten any type of positives, if you will, and strain on the hospital system. So that's what you're seeing in Charlotte. That's why they made the decision that they made. That's why you saw and heard from Chris Peak and the hospital systems that support him in our community. The more we can distance ourselves from each other, the less strain that's going to place on our hospital system. And these projections are just that. They're projections. The more we test, the more we're going to find. So until you have, and I'll use the term, an accurate count of those numbers, projections are a little bit of a slippery slope, but I can assure you we monitor them on an hourly basis, not just a daily basis.
Well, where are those projections in late May?
As far as numbers go?
Yeah.
The last model that I viewed was somewhere around 50%, between 40 and 50% of those tested. Now, you have to remember, just because someone tests positive doesn't necessarily mean that they are what you would consider symptomatic. Some people will have the virus and not show any signs or symptoms. So some of those projections actually include that. So visually, you may not see it. Data-wise, you could, based on the number of tests that we place out there and those that are, quote-unquote, in the category to be tested.
Do you have a number of?
I do not. I do not.
220,000 people in the county, how many people?
Approximately 40 to 50% of those tested could potentially show some type of positive, if you will. We have false positives. There's a lot of clinical terms and definitions, but for the general population, we would anticipate somewhere between the 40 to 50% range. And again, those numbers change. So what I'm telling you right now by this afternoon could be obsolete. So I don't know if that answers your question, Kevin, but I hope that gets you in the general vicinity.
But conservatively speaking, we're talking numbers of positives above 100,000. How do you begin to address the needs? And we realize all of them won't be severe, but we can't have 3,000 beds available.
So I think what, And the question that is being asked is, how can you support or handle such a large number of positives? I think what you heard today is how we prevent that and how we handle that. The goal is not to test the system with 100,000 positive cases, and that's the reason that you're hearing the requests of our local hospital system. And again, they are our front lines in this response. Their ability to do their daily work still goes on. So affecting that flow, flattening the curve that we continue to speak about is why this is so important. The unfortunate truth is that's what's happened in those other vicinities that I mentioned, China, Italy, New York, Louisiana. They were not in front of it, and you're seeing the results of that.
So your modeling shows where we are before we get into the step that we're about to take.
If you do not take social distancing measures, if individuals continue to gather in large groups, that is the potential that you risk, is not being able to handle that volume at a given point. So the more we can distance, the more that we can space out, the more that we can stay home, the more likely that it is that we will not have to deal with that kind of spike.
And just so we're not misleading people, is there a thought that by taking a stay-at-home measure, we can alter that peak time and we can alter that 40 to 50%?
That is absolutely the evidence that tells us that. That's why we're taking these steps and these measures.
Any idea about how much? Is there any modeling?
I certainly can get you the information. I'm not the epidemiologist, but I can certainly get you those numbers and those projections. We'll get that to you, though.
If I don't hear any other questions, we'll go ahead and conclude. I want to thank everybody for coming out. Again, I want to reemphasize that hotline number. Again, that's going to be available for any resident that has questions about this order, any business that has questions about this order. That's going to be 704-866-3170. 704-866-3170. Thank you guys so much.
Thankful, Chris. County Counselor, pastor. All we do. Double a picture of this one.
Thank you. Appreciate it.
Yeah, sure.
Executive order,
Sir, one thing I didn't. Yep, sir. You were talking about 20 to 50% of the people tested. What